The National Health Bill, once it becomes an act, it's still with the National Assembly. It's gone through the Senate. It's gone through the second reading in the Federal House of Representatives. And the assurances are that very soon it will go through the third reading in the Federal House of Representatives. When that bill becomes an act, Nigerians will now begin to have a proper national health system taking shape, whereby we'll be encouraging the local governments to concentrate on delivering primary health care as a primary mandate. The state governments can concentrate on providing the secondary level, which is general hospitals, which some states are doing so well now, while the federal government can then, at the apex, really provide what should be public tertiary health institutions. Of course, there will be overlaps here and there, but people will know, each tier of government will know where to concentrate on. If we did that, then the funds each level is controlling would then be more efficiently directed towards core mandates. And then each of these groups should be linked by, a proper referral system, where primarily people should go and see their family doctors. Now, I'm talking about modernization, but the modernization effort had actually started even before I became minister at the federal level. 14 teaching hospitals were selected, apart from federal medical centers, other specialty hospitals like orthopedic hospitals, neuropsychiatric hospital. But let's concentrate on the university teaching hospital. At least 14 were selected virtually, and that meant virtually all the teaching hospitals owned by the federal government at the start of the program. Now we have more. And we had two phases. Phase 1 had been completed. 8 hospitals benefited from phase 1, which was largely undertaken under the previous administration. And that included places like the Ahmadu Bello University Teaching Hospital Zaria, included places like University of Maiduguri Teaching Hospital, Jos University Teaching Hospital, University of Nigeria Teaching Hospital Enugu, included places like University of Port Harcourt Teaching Hospital, the Jos University Teaching Hospital, University of Ilorin Teaching Hospital, and so on. But there were 8 of them, Lagos University Hospital, University College Hospital, Ibadan. 8 of them benefited from the upgrading of facilities, re-equipping, re-modernization. And then the second phase is taking care of 6 university teaching hospitals, and that is what is now being implemented under this present administration. Already 2 of them have been commissioned. The one at the Osmanu Danfodio University Hospital in Sokoto, at Aminu Kano Teaching Hospital. The other ones are virtually completed. We are hoping that at least the 5th one would have also been completed under the second phase, being commissioned by Mr. President before the end of the year. And the remaining 4, of course, include the Obafemi Awolowo University Teaching Hospital in Ile-Ife, University of Benin Teaching Hospital in Benin, University of Calabar Teaching Hospital, and the Nnamdi Azikiwe University Teaching Hospital in Nnewi. So that modernization had already started. But for me, as minister, I'm looking at doing something more. I think we need at least one good center in Nigeria, accessible to all Nigerians, affordable, where we can make diagnosis. As we say in medicine, medical balance, if we make a diagnosis, problem is half solved. If we can have such a center, because part of the reason why people go abroad is our sometimes inability to make a definite diagnosis. If we have a proper national diagnosis center that would encompass the pathological sciences, endoscopy, what people call keyhole surgery, it can be used for diagnosis, so you don't need to make a large surgical wound just to take a biopsy. That is the kind of vision I have at that level. But we have started something. I talked about data. Yeah. You must always work with data. Without data, you cannot plan. And that's why currently the Federal Minister of Health currently has engaged someone now who is carrying out what I call audit, or call it mapping, of what we have in this country in terms of facilities, that's at the federal level, and matching them with skills. It's now easy for you to say, okay, you have that equipment in Sokoto, but maybe you don't have someone to take care of that. Can we get someone to use that? And so we can now know where to channel patients to, and say, go and have that treatment or investigation done. Alternatively, you have a skill somewhere and nothing to work with. You can say, okay, go there and work. So that's the kind of thing we're doing now, but that is my vision in terms of how to modernize our health services.
All right, thank you very much. Now, you were in New York recently, on a UN health-related issue. Would you want to talk about that?
That was the 3rd replenishment for the Global Fund. The Global Fund is a UN organ. It's a UN agency, as it were, which was established during the tenure of Kofi Annan, who did quite well as UN Secretary General, in tandem with the Millennium Development Goals. And the 6th Millennium Development Goal says that we need to reduce the burden of HIV/AIDS, of tuberculosis, and of malaria and other diseases. But these 3 were named. And so the Secretary General then decided that these 3 named diseases must be a priority. Governments, individuals, private corporate bodies could contribute and then could be channeled to needy countries, particularly the developing world. So from time to time, after every cycle of about 3 years, there's need to replenish because we are dependent on donor funds. But I'm proud to say that Nigeria has taken part in all the 3 replenishments to date. During the first replenishment, Nigeria contributed $10 million. In the second replenishment, Nigeria contributed $10 million. So we've contributed $20 million as a country, and that makes us a donor country. And what I went there to do on behalf of Mr. President and the government of the Federation of Nigeria was to participate in that pledging meeting. We call it the pledging meeting, where donors came again. Even new donors also joined us, and we made further commitments.
Okay, thank you very much. You know, I was smiling when you mentioned giving $10 million because recently I had a chat with an official of the U.S. Global AIDS Coordinator who mentioned to me some scaring figures of what they've spent in Nigeria alone. I know that the U.S. government, for instance, has spent over $25 billion in the fight against HIV/AIDS, and Nigeria is a major beneficiary of that fund. So when you mentioned $10 million, I was smiling. But be that as it may, I would like to ask, of these amounts that we've received from the U.S. government, for instance, in the fight against HIV/AIDS, what level of impact do you think that has had, locally?
Funds come not only from the United States of America. Funds come from other international partners of Nigeria. But let me make this clear. What actually Nigeria is spending, we're not how do they put it? We're not an AIDS-dependent country. Yeah. We thank God for that. Nigeria is not, by far, we're not an AIDS. Nigeria can survive without those AIDS. Okay. But getting those AIDS, of course, is additional funding. And any country can always do with additional funding. So, United States government and other international agencies and countries who are partnering with Nigeria at a bilateral or multilateral level we've appreciated what they've been doing. Yes, how has it helped? Let's take, for instance, HIV/AIDS. The United States government's intervention was mainly through what we call the PEPFAR, which is the President's Emergency a fund for the control of AIDS control and relief, AIDS relief. So that's PEPFAR. So it is a presidential fund from America. They spent a lot of money, but it has been useful. In addition to other funds we've gotten, whether from Global Fund or from Nigeria's own domestic sources. Before, hitherto, you were talking of prevalent rates of HIV/AIDS overall average in Nigeria, national average, of between 5 and 6%. Now it's below 5%. We're talking the current figure for 2008 is 4.6%. This is average, which means in some states it may still be as high as 6%, while some states it might actually be as low as 3%. But it's the national average. So that alone shows that it's been useful. Okay, but we know there are still challenges. For instance, particularly with preventing a HIV positive mother from transmitting it to her unborn child. We're not too happy with what we've done there so far because what we call the coverage is still low. Coverage is still about 15%. And that is worrisome, but we're now going to do something about it. So we have gained from it, but there are still challenges to be made. So it's very important.
All right, information is key. And some of these information you've let out today are things that the ordinary Nigerian does not know. And that's why I'm going to ask, with the little that we've gotten internationally in form of support, do you think the country can beat its hand on the chest and say, yes, we've done well? Can we give good account of such funds?
Yes, we've done well, but we've not done enough.
Okay.
Nigeria has made progress. Nigeria has made progress. Let's even take, at the time, the Millennium Development Goals, when we had the Millennium Summit in the United Nations. Take, for instance, maternal mortality ratio.
Yeah.
National average was more than 800 per 100,000 women. So what we are saying is that if you take 100,000 Nigerian pregnant women, you don't need to be any special prophet. You can decree there that 800, more than 800 were going to die from something that is supposed to be a normal part of life, pregnancy. Yeah. We've not gotten there, but we've made some remarkable progress. Now we're talking, as at 2008, we're now talking of 545. From over 800 to 505. It is progress. But again, we know that by the time we update our data to 2010, which is currently being done, there must have been, So I use that to just illustrate that Nigerians must still be thankful to God and to the government that we're making progress, and we also thank our international collaborators. But we've not done enough. There's still more to be done. That is the point we're making.
Thank you very much. Lastly, as you leave the office of the Honorable Minister of Health, what would you love to be remembered for?
Well, I would want to be remembered for as a minister that came and got things to work better. Okay. As a minister that said we must begin to do and do less of talking.
All right. Thank you very much. It's been a pleasure chatting with you. You must accept what we call professional handshake.
Thank you very much.
On the show. We do that to encourage the young ones out there who will be watching and be drawing inspiration from people like you.
Thank you.
So you must agree with me, viewers, that it's been a very refreshing moment with Professor Chukwu, the Honorable Minister of Health, Federal Republic of Nigeria. I'll see you on the other side to wrap up the show. Please don't go away. Alright viewers, I'm afraid that's the much we can take on the show today. A chat to the professional. It's been refreshing, like I said, having a chat with this core professional who has been assigned with the responsibility of manning our health ministry. If you ask me, I will say he's done remarkably well, and we need more of such actions. Less talk, more action, and I think that's what our country needs to be propelled to the greater height. We keep saying we are a giant of Africa, but it does appear we are slacking in our responsibilities. And with core professionals like Professor Chukwu, I'm sure we'll get there sooner than expected. So, till next week when I come your way, I remain Martin Sobu saying stay blessed, and I'll see you.